right, so I have Mary Smith. She was nauseated, so the doctor ordered Zofran, so we have an order for that. So I gathered my supplies. I'm gonna need 3 10 milliliters syringes of normal saline. I'm going to check the expiration date. They're not expired. And then I have a pre-filled syringe of Zofran, which is 5 milligrams every 2 milliliters. And the expiration date is 12/20/30, so it's not expired. All right, so I did my calculations and I got 1.6 milliliters. And her allergies are morphine. So this is Zofran, so that shouldn't be a problem. So I'm going to get dose accurate without contaminating. Make sure I get out all the bubbles. I'm gonna go to 1.6. Okay. There is some bubbles in there, but I can't get them out right now, but I would. Without contaminating, put the cap back on. I just need to get rid of just a little bit. Okay. Alright. Sorry for getting your paper wet. Okay. So I'm 1.6. Try to turn it. There, I think you can see it. Have to at one of the angles. Alright, 1.6. Okay. So now that I'm dose accurate, I'm going to do my checks. So I have Mary Smith. Her allergies are morphine, and this is Zofran. The order is 4 milligrams IV push every 4 hours, PRN for nausea, and she hasn't had it for 6 hours, so we're in the time frame. Zofran, after my calculations, I need 1.6, got 1.6. Mary Smith, allergies are morphine. Zofran, 4 milligrams IV push every 4 hours, PRN. 1.6 milliliters, 1.6 milliliters. Mary Smith, morphine is her allergies. Zofran, 4 milligrams IV push every 4 hours, PRN, which is 1.6 milliliters. 1.6 milliliters. All right, we are dose accurate. So now I'm going to gather my supplies and go into her room. Hi, Mary. I'm Nicole. I'm your student nurse today. I'm going to wash my hands, provide privacy, put on gloves, or I won't put on gloves yet. Can you please state your name and date of birth for me? Checking the name tag, date of birth, perfect. All right. So the doctor has ordered some Zofran for your nausea, and then I'm going to be putting that through your central line or central IV. There are some side effects that we need to be watching for, which would be dizziness and arrhythmias. So if you feel dizzy, you need to let me know. And then I looked up in the drug book that this needs to be given over 2 to 5 minutes, so I will be doing that when administering. All right, and it does not need to be diluted per the drug book, and there is nothing hanging or running through the lines, and it is compatible with normal saline, so we're good there. All right, so now I will wash my hands, apply gloves. I'm going to take a look at the site, make sure there's no swelling, redness, any pain or anything like that. It looks good. All right, I'm going to take off my gloves, wash my hands. I'm going to put back on my gloves, and then she needs to keep her central line because of her IV antibiotic, long-term antibiotic IV therapy. All right, so what I'm going to do first is move this stuff over here. I have on my gloves. I'm going to clean the site. Do you have any questions before we start? No? Okay. All right, so I'm going to clean this for 15 to 20 seconds, or per the policy of the facility. Okay. Take off the cap without contaminating. Okay. I'm gonna get out the air. All right, air's out. And if there was heparin in the line, I would use an empty syringe and take out the heparin. But in this case, there is no heparin in the line, so I'm going to unlock, check the patency, and I'm getting blood return, so there is no blood clots forming. All right, so now I'm going to administer this normal saline. Okay, I'm going to lock it. Clean. And then with this medication, I will administer over 2 to 5 minutes, and I will be observing Mary for any adverse reactions. Okay, 1.6 milliliters. I'm going to give it over 2 to 5 minutes, but I'm going to have to undo the clamp first. All right. Over 2 to 5 minutes, but in this case, I'm just going to give it all. I'm going to re-clamp. Still observing for any adverse reactions, and we will be monitoring her. All right, cleaning the port again. Getting the air out. Inserting, and I will administer this over the 2 to 5 minutes, just like the medication. But in this case, I'm just going to give it. Okay, I'm going to lock. Clean again. Okay, and now this last flush, I will give pulsating. Generally around like 1 milliliter at a time. Okay. I'm going to lock it. Alright, and then I will clean up, throw away, remove my gloves, wash my hands, ensure Mary is doing alright and she's safe and the bed's lowered, call lights in hand, bed's locked if she needs anything. And then I will leave the room and go document. I would document the date, time that I administered through her central line, Zofran, the amount of Zofran, normal saline, the amount of normal saline that I administered for the flushes, how she tolerated the medication, and any reactions that happened, but she didn't have any reactions, so she's good on that. So then one or a lifespan consideration would be if I had a pediatric or infant patient, I would flush their central line with, or I wouldn't use as much normal saline or whatever is protocol to the hospital or facility due to the shorter length of the tubing. And yeah.